Good day, I'm Jasmine Sedania from BSN 212G, and in this video, I will be performing the parenteral drug administration. So the parenteral drug administration refers to any method of administration other than the oral means. So the most common routes for parenteral administration includes the intradermal, subcutaneous, intramuscular, and the intravenous routes. So for this video, I am going to perform the three routes only, which are the intradermal, intramuscular, and the subcutaneous routes. So these three routes have the same preparation phase. So I am just going to perform it at once to avoid making this video unnecessarily long. So before we proceed with the actual demonstration of the administration of the medication, first thing we want to do is to check the doctor's order and the medication administration record. So this is done so that we will be able to identify what drug is to be given to the patient. So after that, we have to check the label on the medication against the MAR to make sure that the correct medication is being prepared. So now in medication administration, it is very important to perform the three checks. So we'll have to check or read the label of the medication when it is taken from the medication card. We'll have to check the label again before withdrawing the medication, and we'll have to check the label again after withdrawing the medication. So after that is to we have to organize the equipment to save time and effort. So now I am going to proceed with the preparation of the medication from a vial. So first thing to do is to perform hand hygiene to deter the spread of microorganisms. So now I have to prepare the medication vial for drug withdrawal by rotating the vial between the palms of the hand and not by shaking it. So then I have to clean the rubber cap of the previously opened vial with an antiseptic wipe by rubbing it in a circular motion. Now I have to attach a filter needle to draw up a premixed liquid medication from a multi-dose vial. So ensure that the needle is firmly attached to the syringe because loose attachment of needle will not draw the medication properly. So now I have to remove the cap of the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be drawn. Now gradually, carefully insert the needle into the upright vial through the center of the rubber caps, maintaining the sterility of the needle. So now I have to inject the air into the vial, keeping the bevel of the needle above the surface of the medication. So the air will not the air will allow the medication to be drawn out easily. So the bevel is kept above the medication to avoid creating bubbles in the medication. So now I will withdraw the prescribed amount of medication by inverting the vial. So ensure the needle tip is below the fluid level and gradually withdraw the medication. So keeping the tip of the needle below the fluid prevents air from being drawn into the syringe. So after that, I will put back the regular needle and dispose the filter needle. I am now going to proceed with preparation of the medication from an ampule. So of course, we have to perform hand hygiene to deter the spread of microorganisms. So after that, let's now proceed in preparing the medication for drug withdrawal. So first, is to flick the upper stem of the ampule several times with a fingernail. So this will bring all the medication down to the main portion of the ampule. So next, using a piece of alcohol wipe, break off the top by bending it toward you to ensure the ampule is broken away from yourself and away from the others. So the sterile gauze can protect the fingers from broken glass and any glass fragments away from the nurse. So now I will dispose this on the sharps container. So let us now withdraw the medication. So I have to place the ampule on a flat surface and attach the filter needle to the syringe. So the filter needle prevents the glass particles from being withdrawn with the medication. So now I have to remove the cup from the filter needle and insert the needle into the center of the ampule. So with a single dose ampule, hold the ampule slightly on the side if necessary to obtain more than the ordered amount of medication. So after that, dispose the filter needle by placing it in a sharps container to prevent the nurse and the others from accidental injury. So now in giving an injection, replace the filter needle with a regular needle. So tighten the cup in the cup of the needle and push the solution into the needle to the prescribed amount. So now I'll place it on the medication tray. I will now proceed to administering the intradermal injection. So first thing to do is to introduce myself and explain the procedure to the patient. Good day, ma'am. I am Jasmine Sodelia. That will be your student nurse for today. Can you state your name and birthday, please? Thank you. So, ma'am, today I will be doing a skin test for penicillin, which means that I have to inject a small amount of penicillin in your forearm to check if you are allergic to the medication. And after injecting the medication, there should be a small wheel, and you will feel a slight prick as the needle enters the skin. Will that be all right with you, ma'am? Now I have to provide privacy for the client to provide a secure environment and to maintain her dignity. So now I am going to use the forearm as the injection site. So avoid using sites that are tender, inflamed or swollen, and those that have lesions. So I will now apply clean gloves as indicated by agency policy. So now I have to clean the skin at the site using a firm circular motion, starting at the center and widening the circle outward. So allow the area to dry thoroughly. So cleansing the injection site prepares it for the injection. So this method removes pathogen away from the injection site. So while waiting for the antiseptic to dry, remove the needle cap and expels any air bubbles from the syringe. So the small bubbles that adhere to the plunger are of no consequence. So now grasp the syringe in your dominant hand, close to the hub, so holding it between thumb and the forefinger. So hold the needle almost parallel to the skin surface, so with the bevel of the needle up. So with the non-dominant hand, move the skin at the side until it is taut. So the taut skin allows for easier entry of the needle and less discomfort for the patient. So now insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. Now stabilize the syringe and needle and inject the medication carefully and slowly so that it produces a small wheel on the skin. So now we draw the needle quickly at the same angle at which it was inserted, and then activate the needle safety device and apply a bandage if it is indicated. So now dispose the used syringe. So do not massage the area because it can disperse the medication into the tissue or out through the needle insertion. So I can now remove and discard my gloves. Do not recap the needle in order to prevent needle prick injury. So then I have to perform hand hygiene to deter the spread of microorganisms. So then I have to circle the injection site with a black or blue ink to observe for redness or induration or hardening. So now, of course, document all relevant information and record the testing material given. So this includes the time, the dosage, the route, the site, and the nursing assessment. So documenting data serves as a legal evidence that we conduct medicine administration. And then lastly, we have to evaluate the condition of the site for 30 minutes, depending on the test, and then measure the area of redness and induration in millimeters at the largest diameter and document findings. So then document if the client had a positive or negative skin test result, and then follow agency protocol and labeling of allergies. So this is to avoid potential errors from an unintended repeat dose. So I will now proceed in administering intramuscular injections. The first thing to do is to check the MAR because the chart of the patient is more reliable than the medication ticket. So then I have to check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. So now in medication administration, it is very important to perform the three checks. So we'll have to check or read the label of the medication when it is taken from the medication card. We'll have to read again the label before withdrawing the medication, and we'll have to read again the label after withdrawing the medication. So after that, I have to organize the equipment to save time, effort, and energy, and also to prevent interruptions while doing the procedures. So then I have to perform hand hygiene to deter the spread of microorganisms. So now I have to provide privacy to ensure a secure environment for the client and maintain her dignity. So now I have to introduce myself to the client and explain to her the procedures I am about to do. Good day, ma'am. I am Jasmine Sedani from BSN Technology, and I will be your student nurse for today. Can you state your name and birthday, please? Okay, thank you. So, ma'am, your doctor prescribed you a cortisone. So it is an inflammatory, which is anti-inflammatory, which will help you with your tendinitis. So I will be injecting this medication to your shoulder. Will that be alright with you, ma'am? So after that, assist the client to a position depending on the chosen site. So in this procedure, I will be administering the medication on her deltoid muscle. So I will just position the client into supine. So appropriate positioning promotes relaxation of the target muscle. So if the client is uncooperative, it is better to obtain assistance to prevent injury due to sudden movement after needle insertion. So now I have to select and locate a site that is free of skin lesions, tenderness, and swelling. So, and if injections are to be frequent, make sure to avoid using the same site twice in a row to reduce discomfort of intramuscular injection. So after locating the site, I can now apply clean gloves to protect my hands from infection and contamination. So now I am going to clean the site with an antiseptic swab using a circular motion. So start at the center and move upward about 5 centimeters, so that's 2 inches. This prevents entry of bacteria into the injection site. So now I have to transfer and hold the swab between the third and fourth fingers of my non-dominant hand in readiness for needle withdrawals. Or position the swab on the client's wrist, on the client's skin above the intended site. So now I have to remove the needle cover and discard without contaminating the needle. So this is to maintain the sterility of the needle. So now, if using a pre-filled unit dose medication, take caution to avoid dripping medication on the needle prior to injection. So if this does occur, you have to wipe the medication off the needle with a sterile gauze. So I will now proceed in injecting the medication using the Z-track technique. Using the ulnar side of my non-dominant hand, I have to pull the skin approximately 2.5 centimeters to the side. So, under some circumstances, such as for an emaciated client or an infant, the muscle may be pinched. So now, hold the syringe between the thumb and forefinger as if holding a pen or as if holding a dart. And then I have to pierce the skin quickly and smoothly at a 90 degrees angle. So this is done to lessen the client's discomfort. So now I have to hold the barrel of the syringe steadily with my non-dominant hand and aspirate by pulling back the plunger with my dominant hand. So I have to aspirate for 5 to 10 seconds. So if blood appears in the syringe, withdraw the needle and discard the syringe and prepare a new injection. So this step determines whether the needle have been inserted into blood vessels. But if there are no bloods, inject the medication steadily and slowly. So now we draw the needle smoothly at the same angle of the insertion to minimize tissue injury. So now apply gentle pressure at the site with a dry cotton ball. The use of alcohol swabs may cause pain or burning sensation. So now do not massage the area at the site of the injection because it may result in irritation, and if bleeding occurs, apply pressure with a dry sterile gauze until it stops. So after withdrawal, discard the uncapped needle and the attached syringe into the proper receptacle to prevent accidental injury. So now I can now remove my gloves and perform hand hygiene to deter the spread of microorganisms. So now I have to document all relevant information to to avoid potential errors for an unattended repeat dose. So the time of administration, the drug name, the route, and the client's reaction. So then I have to assess for effectiveness of the medication at the time it is expected to act. So this is to evaluate the medication the medication's efficacy. So I will now proceed in administering through subcutaneous injection. So before we proceed with the actual administration of the medication, first thing we would want to do is to check the doctor's order and the medication administration record. So this is done so that we will be able to identify what drug is to be given to the patient. So after that, check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. So now in medication administration, it is very important to perform the three checks. So we'll have to check or read the label of the medication when it is taken from the medication card. We'll have to read the label again before withdrawing the medication, and we'll have to read again the label after withdrawing the medication. So after that is to organize the equipment to save time and effort. So I will now perform hand hygiene to deter the spread of microorganisms. So then I will provide privacy to ensure a secure environment for the client and to maintain her dignity. So now, prior to performing the procedure, I have to introduce myself to the client and verify the client's identity to ensure that the right client receives the right medication. So after that, I have to explain the procedure to the patient. Good day, ma'am. I am Jasmine Sadanio and I will be your student nurse for today. Kindly state your name and birthday, please. Thank you. So, ma'am, I am here to administer your insulin, which means that which will help your body control your blood sugar for your type 1 diabetes. So, I will be injecting the insulin on your abdomen. So, will that be alright with you, ma'am? Okay. So, now assist the client to a position in which the arm, the leg, and the abdomen can be relaxed, depending on the site to be used. So, a relaxed position of the site minimizes discomfort. So for this procedure, I will be using the abdomen. So I will just position the client in supine position. So if the client is uncooperative, then you have to ask assistance from another nurse or the guardian. So now I have to select and locate the site that is free from tenderness, hardness, swelling, or localized inflammation. So these conditions could hinder the absorption of the medication and may also increase the likelihood of injury and discomfort at the injection site. So now I have to apply clean gloves to protect my hand from infection and contamination. So now clean the site with an antiseptic swab starting at the center and clean in a widening circle to about 5 centimeters. So this removes um, skin secretions which contain microorganisms. So now place and hold the swab between the third and fourth finger of the non-dominant hand, or position the swab on the client skin above the intended site. So using this technique keeps the swab readily accessible when the needle is withdrawn. So now I have to remove the needle cup while waiting for the antiseptic to dry. So I have to pull the cup straight off to avoid contaminating the needle by the outside edge of the cup. So now I have to grasp the syringe in my dominant hand by holding it between my thumb and my fingers. So with palm facing on the side or upward for 45 degrees angle insertion, or with the palm downward for a 90 degrees angle insertion. So this is to prepare to inject. So now using the non-dominant hand, pinch or spread the skin at the site and insert the needle using the dominant hand and a firm steady push. So now when the needle is inserted, move your non-dominant hand to the end of the plunger. So now inject the medication by holding the syringe steadily and depressing the plunger with a slow and even pressure. So holding the syringe steadily and injecting the medication at an even pressure minimizes discomfort for the client. So now remove the needle smoothly by pulling along the line of the insertion while depressing the skin with your non-dominant hand. So if bleeds occur, apply pressure to the site with dry sterile gauze until it stops. So now assist the patient into a comfortable position. So then do the aftercare of the materials used. So after that, I can now remove my gloves and perform hand hygiene. So now I have to assess the effectiveness of the medication at the time it is expected to act. So it is very important to evaluate the therapeutic effect of the medication and assess for adverse effects. So lastly, I have to document all the relevant information because timely documentations ensures the patient's safety.